And joining us now to talk about the rising Delta numbers and new variants is senior scholar at the Johns Hopkins University Center for Health Security, Dr. Amish Adalja. Always nice to have you. Another holiday weekend, another COVID surge?
You have to anticipate when there are unvaccinated people that are mixing with each other in these situations where they can't social distance, that we're going to see cases increase. That's going to be inevitable. This virus isn't going anywhere. The goal is, though, to keep those cases from turning into hospitalizations. And that's what vaccinations do. When you get vaccines into high-risk people, you get decoupling of cases from hospitalization. So hopefully we see that continue to be the case. But there are places in the South where there are enough high-risk individuals who are not fully vaccinated that cases do translate into high levels of hospitalization.
Now doing stories about poison control centers, getting calls about people taking anti-parasite drugs, thinking it's a cure for COVID. What's going on, and why is people's faith, more importantly, in the healthcare experts and the healthcare system so flimsy that they're resorting to these measures?
This is really emblematic of the entire pandemic, that we've seen a lot of politicization and conspiracy theories, and ivermectin, which is a parasitic drug that has a use for parasitic infections, really being touted as a cure for COVID-19, despite the fact that we don't have strong evidence to support its use. And what that's done is translated into people taking ivermectin, especially veterinary forms of it, not really under any kind of medical supervision, and getting toxicity. We've seen poison center control calls go up. And we've seen people not want to get vaccinated or not want to go to the doctor because they've got ivermectin in their medicine cabinet. And this is the wrong way to go about it. I think if there were evidence for the use of ivermectin, that would be one thing, but the evidence does not support its use as a treatment or preventive. We've got a vaccine. That's the best way to prevent yourself from getting COVID-19 or from getting a severe case of COVID-19. It's not ivermectin.
And there is, as we just heard in Michael Shore's story, now attention on yet another variant, the Mu variant. It's been detected in almost every state. It might be able to evade immunity from vaccines. What do we need to know about that?
You have to remember that as long as this virus has new people to infect, more and more variants are going to be generated. Most of those variants aren't going to be consequential, and most of those variants are going to be able to be handled by our vaccine when it comes to what matters, preventing serious disease, hospitalization, and death. I think it's important to track the Mu variant, but Delta is such a dominant variant, such a more fit version of this virus, that it is very hard for any variant to get a toehold if you've got your country basically engulfed with Delta. So I don't suspect it's going to be a major problem here in the U.S., but it's important to track and learn more about.
All right, Dr. Amish Adalja, thank you very much for joining us tonight.
Thank you.
And we'll be right back.